start with the two-hit theory of tumor suppressor gene activation in cancer. So we talked about the fact that oncogenes, they promote cell division, while tumor suppressors inhibit cell division. Proteins encoded by proto-oncogenes, they promote cancer when they're activated and when they are overexpressed, or when they get a mutation that's a gain-of-function mutation. On the other hand, variants in tumor suppressor genes contribute to the carcinogenesis by a mechanism of loss of function for both of alleles of the gene. Remember, one hit is enough for the proto-oncogene to induce a cell abnormal behavior. On the other hand, in tumor suppressors, both alleles for the same genes, they need to receive the hits. The products of many tumor suppressor genes have been isolated and characterized. The right side table here shows different tumor suppressors that are associated with different diseases. The variants, they could be somatic or inherited. For instance, RB1 is associated with retinoblastoma, and neurofibromatosis is driven by NF2. NF1 drives neurofibromatosis type 1. BRCA1 and 2 are susceptible genes for risk genes, call it whatever you want, for breast and ovarian cancer. In this context, we need to talk about, shed some light about a very crucial and important theory in the field of cancer genetics, which is known as two-hit theory. And the two-hit theory is involved in both non-hereditary and hereditary cancer. So let's start with hereditary cancer. Hereditary means that disease-causing allele is inherited from one of the parents. Therefore, an individual, or zygote when it forms, or develops as an embryo and fetus, then child, adult, etc., their cells are supposed to be carrying one variant that's inherited from one of the parents, while the second allele should be normal. What happens, a second hit occurs by chance to the second allele of the same gene, which renders both alleles of the same gene to be damaged. And if that gene is a driver gene for cancer, then it induces cancer cells to be formed through the transformation process. In non-hereditary cancer is even stranger. No mutations are inherited from the parents. Rather, a hit occurs by chance in a group of cells in a certain tissue. And the second hit to the other allele also occurs by chance. This will increase the risk for developing cancer. As a matter of fact, the first disease that has been related to the two-hit theory is retinoblastoma. If you look at this family pedigree, it's suggested that an inherited form of retinoblastoma, as you can see here, every generation is affected. So a mode of inheritance is dominant, even though the gene itself, both alleles need to be mutated for the disease to manifest. So a germline mutation is inherited from one of the parents, and a second hit appears in a cell or a population of cells of a certain tissue. Therefore, both alleles are mutated, and this will result in higher risk for developing bilateral early onset retinoblastoma. If we look at the disease on the somatic level, non-inherited retinoblastoma and sporadic forms of retinoblastoma, again, both alleles that need to be inactivated or damaged or hit, call it whatever you want. But in this case, both lesions are acquired by chance rather than being inherited from the parents. Typically, the tumor is unilateral, not bilateral, and the age of onset is later than hereditary retinoblastoma. This figure again shows two-hit theory. If for someone who inherits a mutation in one allele of the retinoblastoma, they have 100,000 times more likelihood to develop a second hit in the second allele of RB1 gene. Go ahead, what's your question?
دكتور يعني هو المرض الدومينانت المفروض قليل واحد بكفي عشان انصاب فيه، بس مع ذلك بيحتاج اثنين لانه تيومر سبريسر.
سؤالك منطقي. المود of inheritance is dominant, but اللي هو هون الكونتراكشن بالكونسبت 100% صح، طريقة تفكيرك منطقية، بس الثيوري تحطنا بسيتويشن while the disease will not manifest until both alleles are mutated for RB1 gene.
بس انه اذا
On the other hand,
mutation الثاني احتمال كبير يصير له، يعني بصير زي كأنه اكيد يعني.
exactly
one mutation
لازم
بتصير
يصير
في لانها
السكند allele.
بتسحب وراها الثانية. اوكي ممكن.
It's not 100% guaranteed. If I have one mutated allele in RB1 that I will become, or I will develop the disease in my eye, I still need a second mutation to occur. It's 100,000 times more likely to happen. It's not 100%, but there is a high likelihood for this to happen. When both alleles are mutated due to the second hit, then the disease will manifest. So the disease will not manifest without a second hit.
هلا عشان هيك هو الريتينوبلاستوما عنده decreased penetrance، يعني عشان انه مش اكيد انت تنصاب بالمرض when you have the one diseased allele، بس انه على الاغلب انه it will increase the risk.
We will talk about the penetrance later on. Idea behind الحكي اللي بتحكيه انت، فيعني your thinking is in the correct direction. So what we were saying that most tumor suppressor genes, they require both alleles to be inactivated to cause a phenotypic change. Back in 1970s, tumor suppressors oncogenes were not discovered. No one knew nothing. In 1971, Alfred Conson, he did a mathematical analysis. He built the two-hit theory. لأنه genetics of the two-hit theory, as a matter of fact, the tumor suppressors and oncogenes were not discovered in the 70s. His geniusity drove him to build the two-hit theory based on a mathematical approach, not genetic approach, to explain a biological phenomenon. I left this video for you to watch at your convenience. What he suggested is what we now know about, is that we need two hits to cause cancer. Remember, he doesn't know the RB1 gene was not discovered. The tumor suppressor with oncogenes, they knew nothing about them. If you put yourself in a time machine at this time, so you noticed there are those children who are developing bilateral and others who develop unilateral retinoblastoma. He also noticed the age of onset of the disease is different between both groups of those children. This two-hit theory that, based on statistical analysis with conclusion tau, is now widely accepted as the explanation of many hereditary cancers, including familial polyposis, coli, familial breast cancer, NF1, Lynch, and Li-Fortini syndromes. This is another YouTube video. I'm not sure if he's a Nobel laureate or not, but he's of that caliber. In 1986, RB gene was the first tumor suppressor gene to be identified in medical history. 15 years after, he explained how retinoblastoma occurs. The tumor suppressor genes in autosomal dominant cancer syndrome, retinoblastoma هو the prototype disease caused by variants in tumor suppressor genes. هو أول disease studied by Alfred Conson, and it's a rare malignant tumor of the retina in infants. Well, incidence is approximately about 1 in 20,000 births. Diagnosis of retinoblastoma, as you can see, high fundus imaging. So basically, the pupil, and if you look through a fundoscope, you basically magnifying lens through the pupil of the eye, you would see the retina. Those are malignant cells. Here, it's a unilateral retinoblastoma, where you can see the white color in the center of the eye reflecting light. Diagnosis is followed by removal of the affected eye. If the diagnosis was caught at an earlier stage where the tumor is small, maybe the treatment with local therapy could preserve the eye from being removed. That's why genetic testing and family history is really important. Approximately 40% of the cases with retinoblastoma are hereditary, in which child inherits one mutant allele. Oh, in rare situations, okay, so let's take a step back. A zygote divides by mitosis with daughter cells whom they develop into tissues, organs, and systems, correct? Which means that all of the cells in our body should have the same DNA sequence of the zygote, and all of the cells in different tissues, they all came about through mitosis. The DNA should be sequenced in your body. For example, if you sequence DNA from your blood or heart or nervous system, or if you sequence the entire DNA in your colon or in any other tissue, the DNA sequence should be the same. And all of those cells and all of those different tissues originated by mitosis. And remember, the definition of mitosis are identical daughter cells on a genetic level. يعني باللغة العربية البسيطة، إذا أنا بعمل sequencing DNA من البلد أو بعمل sequencing لنفس الشخص، DNA عملت له extraction من brain cells, DNA sequence should be the same لأنه the brain cells and the blood, they originated by mitosis from an ancestral cell اللي هي zygote. But there is a catch اللي هي المزايزن. During my embryonic or fetal development, that small group of cells acquire a random mutation. And this variant, it could be in my gonads. So if you sequence my DNA from the blood, a DNA sequence could give I don't have a mutation. If you sequence my testicular biopsy, you would discover there is a mutation. And this is a germline mosaicism. Tile background. In this context, what we're saying, an inherited mutation in RB1 gene, imma taken by a parent who has RB1 gene mutation in all of the tissues, or parent who has an RB1 gene mutation in all of their tissues, but in their reproductive organ tissues. Make sense?
دكتور ليش دائما انت بتحكي ليش دائما بتحكي بالتستس؟ يعني انت دائما بس تحكي عن الموزايزم بحسك يعني ليش دائما بالريبرودكتيف سيستم؟ مش الموزايزم ممكن يكون باي part of the cells of the body، يعني group of cells معينين؟
صحيح مظبوط. Assume someone has a mutation in their pancreatic cells, but the same person does not have this mutation in the rest of the body tissues. Would you expect that this person would pass on the mutation to his offsprings, to his children?
No.
You're right. No, he will not pass on the mutation to his children. And the reason is
ممكن تكون acquired mutation.
لأنها acquired mutation, definitely acquired, لازم تكون acquired, and it does not exist in the reproductive in the gonads, which means that the mutation should exist in the gonads of mosaic people to pass on that mutation. The common scenario, the mutation, mainly, if I have the mutation, all of my body cells will have this mutation, لأنها inherited, and I pass it on to my offsprings, where they also, all of their body cells will have this mutation as well. Exactly what this sentence means. It means that 40% of cases of retinoblastoma are of heritable form, in which the child inherits one mutant allele of the RB1 gene through the germline from either a heterozygous parent or, more rarely, from a parent with germline mosaicism for an RB1 variant.
دكتور بس أسأل سؤال. يعني البيشنت اللي عنده جيرم لاين موزايكيزم للار بي 1 هو نفسه، يعني اللي عنده اياها ما يعتبر انه ورثها من اهله، يعني لانها اجت بعد بالميتوسيس خلال الامبريوجينيسيس تاعه.
صحيح.
لكن لما
صحيح.
يورثها
ولكن
لابنه،
كمل.
لما يورثها لابنه اذا انها كانت الجيرم لاين خصوصا بالريبرودكتيف سيستم، وقتها ابنه يعتبر هيريتابل، صاب هيريتابل ريتينوبلاستوما. هيك يعني. شكرا.
ودكتور اللي بيكون عنده مزايزم بالجيرم لاين مثلا بالتستس ما بيكون عنده الديزيز، صح؟
صح. ليش؟ لأنه الريتنال سيلز ما فيها mutation.
تمام.
So if you look at the figure here, it nicely represents our discussion. Plus is the normal allele, RB is the mutant allele. What happens here is that the mutant allele is inherited from the parent, even though both alleles are mutated for the disease to manifest. The inheritance occurs as a dominant trait, and this is a pedigree with retinoblastoma. Even though both alleles need to be mutated in order for the disease to manifest, the trait is inherited in the pedigree in an autosomal dominant manner. Let's go over this sentence together. Because the large number of primordial retinoblasts, remember my retinoblastoma were the progenitor cells that give rise to retinal cells, and the rapid rate of proliferation, when they receive a mutated allele, they make it very likely that a somatic mutation will occur as a second hit in one or more of the 10 to the power 6 retinoblasts already carrying inherited RB1 mutation. And in simple language, for someone who inherits the RB1 mutation, all of the cells across all of the tissues, organs in their body, they have this mutation, correct? This gene, when mutated, causes a disease in the retina. So let's talk about the retinal cells. There is around 1 million retinoblasts. هدول they develop and differentiate into retinal cells. Now already, all of them, they have the first hit inherited. If any of them receive the second hit, a cell or a group of cells that receive the second hit, it will divide much faster at a higher rate. Well, excessive proliferation will give rise to retinoblastoma as the cell accumulate more mutations. Yani, this individual is normal, healthy individual. This individual is not carrying mutations. or the individual could receive a hit in one of the two alleles, but not the other one. Still, that individual will be normal. Hereditary retinoblastoma, individual who's heterozygous, when those cells are dividing, they're still normal cells, but one of them might have the second hit. This cell will divide at a faster rate than the rest of the cells and accumulating more mutations, and eventually a retinoblastoma will manifest. In heterozygotes for the disorder, they often have tumors arising at multiple sites. Then ممكن this cell gives rise to tumor, another cell يصير عنده two hits gives rise to another site in one eye, such as multifocal tumors in one eye. يعني الآية نفسها ظهر نفس الريتنال region more than one. يعني here in this image in the fundus this is one focal. ممكن multifocal يكون هون وهون كمان لأنه originated from cells that received second hits in the same eye. The multifocal tumors in one eye, in both eyes, bilateral retinoblastoma, as well as pineal gland. For those people with hereditary retinoblastoma, they refer to as trilateral retinoblastoma, where both eyes and the pineal gland undergo cancer. Bear in mind, the occurrence of a second hit is a matter of chance, high chance, and does not occur 100% of the time. The penetrance of RB, therefore, although greater than 90%, is not complete penetrance. The other 60% of the cases of retinoblastoma are not hereditary, somatic. Both alleles of RB1 in a single cell have been inactivated independently by chance. But because two hits in the same cell is a statistically rare event, it's usually only one single clonal tumor, مش multifocal, and the retinoblastoma is found at one location in one eye but not the other. Bear in mind, a unilateral tumor is not a guarantee that a child does not have heritable form of retinoblastoma. 50% of all patients with heritable type, they develop a tumor in one, even though all of their body cells, they have inherited mutation. Okay, سؤال and my question. 50% of retinoblastoma patients, they develop unilateral tumor in one eye, even though it is hereditary.
دكتور ممكن عشان السكند هيت ممكن تصير بعين واحدة يعني.
بالضبط, exactly. هاي اللي بتحكي ليان صح. لأنه second hit occurred in one eye but not the other, even though both eyes they have a high probability of receiving a random second hit. But this is the situation of non-hereditary retinoblastoma.
لما أنت حكيت إنه البنترنس approximately 90%. هلا مش نحن حكينا انه انا اللي بعرفه انه البنترنس معناته انه يكون عندك خلينا نحكي ميوتيشن ولكن الاعراض ما تظهر او انه هو ما يصير في مرض, صحيح؟
البنترنس اما complete penetrance او incomplete penetrance. Incomplete penetrance, the mutation exists but the disease does not manifest all the time. بحالة الهيريديتاري ريتينوبلاستوما. شو رايك ابراهيم؟
ما سمعت شيء.
كنت عم بسألك في حالة بالمرض اللي عمانا بندرسه الهيريديتاري ريتينوبلاستوما. Is it complete ولا incomplete penetrance as a disease?
إذا صار second hit complete المفروض.
لا أنا ما بس in general بحكي. Incomplete. Why? If this individual does not receive a second hit, they carry a mutation, but they don't develop the disease. If they receive the second hit, the disease will penetrate. So you need the two-hit theory تصير عشان الديزيز يصير penetrant. بمعنى آخر لو أنا وياك إحنا we inherited الميوتيشن هاي بالRB1 جين, ممكن أنا يصير عندي retinoblastoma وممكن عندك ما عندك صح؟ By chance, whereas you did not.
يعني أنا اللي كان قصدي إنه أنت ما بتستنى السكند ميوتيشن عشان تحكي عن penetrance. أنت penetrance بتحكي من الفيرست ميوتيشن. إذا كان في first mutation penetrance 90% لأنه يعني في عندك probability إنك you do not acquire the second one, صح؟
From a practical point situation, you will not sequence cells in the retina cell by cell to find the cell that carries the second hit. As a matter of fact, when you sequence this patient who has a second hit, you will discover only one hit. لأنه their blood did not receive a second hit. The other difference هو average age of onset. The sporadic form is in early childhood, later than infants اللي هو onset of the hereditary form of a بلاستوما.
دكتور حكينا الهيريديتري فورم 50% يصير in both eyes.
لا حكينا الهيريديتري فورم 85% in both eyes.
85 عشان
لأن 15% with the heritable type will develop tumor unilaterally أو in one eye.
تمام شكرا
بس اللي حكينا إنه 60% are non-hereditary يعني this scenario 40% is hereditary.
دكتور شو بفرق النون عن الهيريديتري بالايز يعني يوني او بايلاترال؟
hereditary بيكون 85% chance يكون bilateral whereas the non-hereditary unilateral. كمان عندنا multifocal formation بالhereditary بينما ما عندنا multifocal formation بالnon-hereditary. The age of onset is another difference. The timeline to receive one somatic hit is shorter than the timeline needed to receive two random somatic hits in the same cell. Therefore, the age of onset بيكون بالhereditary form during the infancy while بالsporadic form بيكون بالearly childhood.
تمام دكتور شكرا.
Makes sense, right?
صح.
Yeah, a small percentage of patients with retinoblastoma, the variant responsible is cytogenetically detectable deletion or translocation in a portion of chromosome 13 that carries the RB1 gene. So such chromosomal مش على genetic level أو على nucleotide, rather على chromosomal level, they disrupt not only the RB1 in a large region, كمان genes in the RB1 region, which may lead to dysmorphic features in addition to retinoblastoma. That's why some patients with retinoblastoma and dysmorphic features would make you think maybe on the genetic level that individual is suffering from an abnormality on the chromosomal level rather than the genetic level.
قبل شوي حكيت إنه لو واحد already hereditary وما أخذ الفيرست هيت من أهله مش لو صار في عندك second hit بالريتينال سيلز لما تاخذ عين من البلد مش هتعملها ديتكت.
صحيح.
طيب مش في احتمال انه السكند هيت تصير بالبلود سيلز برضه ولا هي بس بتصير بالريتينال؟
ممكن تصير بالبلد برضه بس احتمال اقل. functionality في الار بي 1 جين بتكون exists بشكل اعلى بالاffected tissue صح؟ بصيروا vulnerable هدول السيلز for second hit.
منطقي اوكي شكرا.
دكتور شو يعني dysmorphic features؟
يعني بيكون عنده abnormalities عدا البلاستوما. يعني مثلا افترضي عنده translocation أو partial deletion بكروموسوم 13 ممكن يكون عنده abnormal facial features لأنه صار عندي deletion part of the chromosome بحوي many genes including ال RB1.
تمام شكرا دكتور.
Second hit تيجي in different flavors. ممكن تكون at the genetic level ممكن تكون زي ما حكينا شوي on the chromosomal level, but the common theme, the common flavor of a second hit is the loss of function. Bear in mind, a theme of oncogenes on the other hand is a gain of function. The RB1 gene product or the protein itself is involved in inducing or repressing a cell cycle. When it is not phosphorylated, it binds to the E2F and therefore this will inhibit the cell cycle بالS phase. When it's phosphorylated, it will detach from the E2F, well E2F transcription factor that will drive the expression of genes allowing a cell to undergo growth and the cell cycle. Therefore, a loss of the RB1 gene, when you lose the loss of function mutation, it means that one of the regulatory elements of the cell cycle and growth is lost. So therefore, E2F is functioning all the time. The important checkpoint that regulates controlled cell proliferation is lost.